Diabetes is a chronic disease that affects millions of people around the world. It is characterized by high levels of sugar, glucose, in the blood, which can cause a range of health problems if left untreated. In this video, we will explore the basics of diabetes, including its causes, symptoms, diagnosis, and treatment. Section 1: Types of diabetes. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes occurs when the immune system attacks and destroys the cells in the pancreas that produce insulin, a hormone that regulates blood sugar levels. Without insulin, the body cannot use glucose for energy, leading to high blood sugar levels. Type 1 diabetes typically develops in childhood or adolescence, but can occur at any age. It requires lifelong insulin therapy to manage. Type 2 diabetes occurs when the body becomes resistant to insulin or does not produce enough insulin to maintain normal blood sugar levels. This type of diabetes is often associated with obesity and a sedentary lifestyle, and can often be managed with a combination of lifestyle changes, such as a healthy diet and exercise, and medication. Section 2: Causes of diabetes. The causes of diabetes are complex and not fully understood. For type 1 diabetes, it is thought that genetic factors play a role, along with environmental triggers such as viruses and other infections. For type 2 diabetes, the most significant risk factors include obesity, a sedentary lifestyle, and a diet high in refined carbohydrates and processed foods. Other risk factors include family history, ethnicity, age, and certain medical conditions such as polycystic ovary syndrome. Section 3: Symptoms of diabetes. The symptoms of diabetes can vary depending on the type and severity of the condition. Some common symptoms include increased thirst and urination, fatigue, blurry vision, slow healing of wounds, tingling or numbness in the hands and feet. In type 1 diabetes, symptoms may develop quickly over a few weeks or months, whereas in type 2 diabetes, symptoms may develop gradually over a period of years. Section 4: Diagnosis of diabetes. Diabetes is typically diagnosed with a blood test that measures the level of glucose in the blood. A fasting plasma glucose test or an oral glucose tolerance test may be used to diagnose diabetes. In some cases, additional tests may be necessary to determine the type of diabetes, such as a test for the presence of autoantibodies that are associated with type 1 diabetes. Section 5: Treatment of diabetes. The treatment of diabetes depends on the type and severity of the condition. For type 1 diabetes, insulin therapy is the mainstay of treatment. This involves regular injections of insulin or the use of an insulin pump. For type 2 diabetes, treatment may involve lifestyle changes such as diet and exercise, as well as medication to help control blood sugar levels. Some common medications used to treat type 2 diabetes include metformin, sulfonylureas, and thiazolidinedionase. In addition to medication and lifestyle changes, people with diabetes may need to monitor their blood sugar levels regularly to ensure they are within a healthy range. This may involve using a blood glucose meter or continuous glucose monitoring system. Section 6. Complications of diabetes. If left untreated or poorly managed, diabetes can lead to a range of complications, including heart disease and stroke, kidney damage, nerve damage, neuropathy, eye damage, retinopathy, foot damage, ulcers and infections. It's important for people with diabetes to work closely with their healthcare provider to manage their condition and prevent complications. Section 7. Prevention of diabetes. While there is no guaranteed way to prevent diabetes, there are steps people can take to reduce their risk of developing type 2 diabetes. These include maintaining a healthy weight through a balanced diet and regular exercise, avoiding sugary drinks and foods high in refined carbohydrates, quitting smoking, managing stress levels, getting regular checkups with a healthcare provider to monitor blood sugar levels and other health indicators. For people with a family history of diabetes or other risk factors, regular screening may be recommended to catch the condition early and prevent complications. Conclusion. Diabetes is a chronic disease that affects millions of people worldwide. It is caused by a complex interplay of genetic and environmental factors and can lead to a range of serious health complications if left untreated. However, with proper management, many people with diabetes can lead healthy and fulfilling lives. It's important for people with diabetes to work closely with their healthcare provider to manage their condition and prevent complications, and for individuals at risk to take steps to reduce their risk of developing type 2 diabetes. Comment below if you want more videos on this topic, and do subscribe to our channel for more content like this, and don't forget to hit the like button.